Hi, Eileen Veilleux The Fam here. Welcome to another installment in our mini mental health series. In this installment, we will be going over stuttering. Before we begin, let me just remind you to please watch the full video because in the video, there'll be 3 key words throughout the video. When I get to the key word, I will say keyword and then what the keyword is. At the end of the video in the comments section, along with the genuine comment, put in what the 3 keywords are to be eligible for my free merch giveaway when I reach 2,000 subscribers. So let's get started. What is stuttering? Well, stuttering, also called keyword stammering, or child onset fluency disorder, is a speech disorder that involves frequent and significant problems with normal fluency and flow of speech. People who stutter know what they want to say, but have difficulty saying it. For example, they may repeat or prolong a word, a syllable, a consonant, or a vowel sound. Or they may pause during speech because they've reached a problematic word or sound. Stuttering is common among young children as a normal part of learning to speak. Young children may stutter when their speech and language abilities aren't developed enough to keep up with what they want to say. Most children outgrow this developmental stuttering. Sometimes, however, though, stuttering is a chronic condition that persists into adulthood. This type of stuttering can have an impact on self-esteem and interactions with other people. Children and adults who stutter may benefit from treatments such as speech therapy, using electronic devices to improve speech fluency, or cognitive behavioral therapy. So what are the symptoms of stuttering, you may ask? Well, stuttering signs and symptoms may include difficulty starting a word, phrase, or sentence, prolonging a word or sound within a word, repetition of a sound, syllable, or word, brief silence for certain syllables or words, or pauses within a word like a broken word, addition of extra words such as if difficulty moving to the next word is anticipated, excess tension, tightness or movement of the face or upper body to produce the word, anxiety about talking, and limited ability to effectively communicate. The speech difficulties of stuttering may be accompanied by rapid eye blinks, tremors of the lips or jaw, facial tics, head jerks, and clenching fists. Stuttering may be worse when the person is excited, tired, or under stress, or when feeling self-conscious, hurried, or pressured. Situations such as speaking in front of a group or talking on the phone can be particularly difficult for people who stutter. However, most people who stutter can speak without stuttering when they talk to themselves and when they sing or speak in unison with someone else. So when should you see a doctor or a speech language pathologist about stuttering? Well, it's common for children between the ages of 2 and 5 to go through periods when they may stutter. For most children, this is part of learning to speak, and it gets better on its own. However, stuttering that persists may require treatment to improve speech fluency. You should call your doctor for a referral or contact a speech language pathologist directly for an appointment if stuttering lasts more than 6 months, occurs with other speech or language problems, becomes more difficult, frequent, or continues as a child grows older, occurs with muscle tightening or visibly struggling to speak, affects the ability to effectively communicate at school, at work, or in social interactions, causes anxiety or emotional problems such as fear or avoidance of situations when speaking is required, or it begins as an adult. So what causes stuttering? Do we know? Well, research continued to study the underlying causes of keyword developmental stuttering. A combination of factors may be involved. Possible causes of developmental stuttering include abnormalities in speech motor control, which some evidence indicates that abnormalities in speech motor control, such as timing, sensory, and motor coordination, may be involved. Genetics. Stuttering tends to run in families. It appears that stuttering can result from inherited genetic abnormalities. So, stuttering resulting from other causes, is there any? Well, speech fluency can be disrupted from causes other than developmental stuttering. A stroke, traumatic brain injury, or other brain disorders can cause speech that is slow or has pauses or repeated sounds, which is called neurogenic stuttering. Now, speech fluency can also be disrupted in the context of emotional distress. Speakers who do not stutter may experience disfluency when they are nervous or feeling pressured. These situations may also cause speakers who stutter to be less fluent. Speech difficulties that appear after an emotional trauma, which is psychogenic stuttering, also common, are not the same as developmental stuttering. So are there any risk factors involved with stuttering? Well, males are much more likely to stutter than females are. Factors that increase the risk of stuttering include delayed childhood development. Children who have developmental delays or other speech problems may be more likely to stutter. Having relatives who stutter, stuttering tends to run in families. Stress. Stress in the family, high parental expectations, or other types of pressure can worsen the existing stuttering. So what are the complications of stuttering, if there's any? Well, stuttering can lead to problems, keyword, communicating with others, being anxious about speaking, not speaking or avoiding situations that require speaking, loss of social, school, or work participation and success, being bullied or teased, and low self-esteem. So that's, overall on the causes of and symptoms of stuttering. The next one we will be going over the diagnosis and treatment of stuttering. I hope that this has helped you out. Remember, if you come across somebody that stutters, don't pick on them, don't make fun of them. It's nothing they can control. Help them feel more relaxed and comfortable. Be patient, be loving, be understanding. And you can do all of this by seeing through your heart and not with the eyes. Because what your eyes see isn't important. What really matters is invisible to the eye, because only the heart can see it. Excuse me. And when the heart sees it, that's when we can help others feel more comfortable about their situation. None of us on this earth are made perfectly. We all are flawed in some shape, form, or matter, whether it's mentally or physically. None of us are perfect. The only perfect person is not a person. He's a deity, and that is God himself. And for those that don't believe in God, well, nobody on this earth is perfect. Whatever your higher power is, whoever your higher power is, remember, we are all created equally here. There is no one better than anyone else. I'm not better than you, and you're not better than me. We're created equally. But we're also created to be loving. Have you ever noticed why dogs considered man's best friend? I can tell you why. Because they're so much like children, the way we were supposed to be. when we're little. And if you're an adult that has children, you know how much you love your kids when they're at a young age, with their innocent, their unconditional love. That's the way we're supposed to be. It does unconditional love does not mean letting somebody walk all over you, but it does mean to use your heart more, to see with your heart more. And you can learn how to do that by accepting people for who they are. Don't try to conform somebody into what you want them to be. Love them for who they are, because they were created just like you were. They deserve the same compassion, love, understanding, all the things that you want in life, they deserve also. It doesn't matter whether they're mentally disabled or physically disabled. Give them that same respect. And by doing that, you see with your heart and not your eyes. And it's a simple thing to learn to do. Before you speak, think. Is there a reason why this person's like this? Could there be a bigger issue here? Don't look at them, and if they piss you off or something, and you don't try to not understand them and just blurt something mean out. You don't know what they're going through. You don't know what their life is about. I encourage each and every one of you to practice seeing with your heart. If that even just means being in your own house, learning not to use your eyes. It will, when you cover your eyes, if you're fully sighted, let me tell you something. If you are fully sighted and you take away your sight by blindfolding yourself or whatever, your other senses in your body pick up. And there's a reason for that. That's to enhance so you can do what you need to do. But at the same token, if you cannot see with your eyes, you learn how to judge from here and not with these. Because when you judge with your eyes, you could be deceived. I've said this time and time before. It's like having a nut or a book. You can take any book. You know what that book's about just by looking at the cover? Of course you don't. You can get a general idea, but you have no idea until you open the book and start reading it, whether it's going to be a good book or a bad book. Same thing with the peanut. You could have a peanut. By looking at the shell of the peanut, it looks like it's a good peanut. But you don't know if the peanut inside that shell is rotten or not until you crack open that peanut. Well, it's the same thing with people. This is the shell, and inside is the nut, the meat. You don't know what that meat is until you look inside to see what makes that person. So remember, until I see you again, always look with your heart and not your eyes. And remember, I'm going to get up and close and personal with you because I want you to know that you out there truly matter to me. Each and every one of you are important. You are uniquely made and you matter. I don't care if you're mentally disabled, physically disabled, and have no disabilities at all. You all matter to me. You all count for something. We're all uniquely made for our own reasons. And I love each and every one of you out there. So until I see you again, I love you. Have a great day, guys. Bye.